during the time of me fasting, what am I taking? What am I eating? Is it just water? Because you hear different things, coffee, you have juice, you can have all these other things, apple juice. What's yours?
So water fasting is just that, water only. In fact, it's distilled water only, fractionally steamed distilled water. So the only thing they're getting during this fasting experience of 5 to 40 days is water only. Now, there is juice fast and other modified programs that people can do, and they can be very helpful, but they're not water fasting. Water fasting induces a unique biological adaptation that's really unique to water fasting. So for the conditions that we're treating, there's nothing that works quite as well as doing water-only fasting. If you're trying to normalize blood pressure, overcome type 2 diabetes by reducing insulin resistance, break down lymphoma tumors, dealing with these autoimmune diseases, water fasting is a really unique biological adaptation.
Water fasting. So that means for 7 days, all I'm having is water.
For anywhere from 5 to 40 days, correct.
Anywhere between 5 to 40 days, all I'm having is water. And so if you can walk me through this, day one, what happens? Because, the typical one we hear about is the 18-hour one. You start at 6 o'clock, you don't eat till lunch, 12 o'clock. That's what you hear about 18-hour fasting, So what is the body
same
going
process,
through within the time?
Yeah, it's the same process, but it's going to be extended out. Instead of breaking your fast with breakfast, we would continue. Now, in our patients, let's be clear. First, there's a review of history, exam, and laboratory baseline. So we know from the history, the physical examination, and the laboratory testing that the person is a good candidate, that they have the reserves, that they have adequate kidney function, that they've got cardiac stability, that we've gotten them weaned off their medication safely beforehand. And they've done a good lead-in program. So they've eaten fruit, salad, and steamed vegetables only for a couple of days. There's no meat, fish, fowl, eggs, dairy products, oil, salt, sugar, or highly processed foods being used. That makes the transition to fasting much easier. And as I said, they've been stabilized off any medications. Now they start fasting. During the fasting state, we impose a degree of rest. So people can move around. We even have little classes and things that they do, but basically they're not doing vigorous exercise or intense, stressful activities. And the reason for that is if you are extending a water fast and you continue to say exercise, what you would do is you'd force the body to generate more glucose to provide use for the muscle and the brain. And the only place that it can get that glucose after the glycogen reserves, after the first, say, 48 hours, is through a process called gluconeogenesis, which is a breakdown of protein. So we don't want to deplete a patient's protein reserves. We want them to burn fat. And what's really exciting is we have actually recently acquired a DEXA scanner, and we've been able to do really detailed whole body composition changes. And what we've done in this study that we're publishing is we've been able to show that visceral fat is preferentially mobilized during fasting. Not just fat. Fat is preferentially mobilized, but specifically visceral fat. So, for example, a person might lose 20% of their total body fat during fasting, but they may lose 40 to 60% of their visceral fat. So the body's actually going in and mobilizing this fat that tends to accumulate around the core and around the organs that's thought to be most associated with compromised health. It'll mobilize visceral fat first and preferentially, and then it'll mobilize adipose tissue, and then it will preserve protein. So that when you look at the weight that's lost during fasting, let's say a person loses, say, 20 pounds. Some of that's fat, some of it's protein, some of it's glycogen, some of it's fiber that was in the gut, some of it's fluids. And then when they come off the fast, they regain weight. But the weight that's regained during recovery is almost exclusively protein, water, fiber, and glycogen, and not fat. In fact, the fat loss continues during refeeding. And so what we found with water-only fasting is it's a unique way of mobilizing visceral fat, which helps open up the blood vessels, gets rid of the health-compromising components, much more so than, say, going on a high-protein, high-fat, keto-type diet. The fasting mimicking diets, which can blunt hunger and facilitate weight loss, that may have some short-term benefit, may have some long-term serious consequences. Just like with water fasting, you wouldn't water fast forever. You water fast for a period of time, and then you go back to eating a health-promoting diet. But the net effect on the body is to reverse visceral fat, normalize blood pressure. It reduces insulin resistance, which allows diabetics to normalize their blood sugar levels. It breaks down some of the masses. For example, a person might lose 10% of their body weight, but they won't lose 10% of their tumor. They may lose 50% or 100% of their mass, because the body's preferentially mobilizing tissues in inverse proportion to their need. And that's why visceral fat, tumors, growths, other things sometimes go away in fasting, disproportionate to the percentage of weight that the body loses.